Hi, welcome to Doc Talks this week. This week is a follow-up of last week, and we are going to be talking about injuries, the most common injuries that you get while skiing.
So last week, Coach Francis, he was telling us about a story where he went up to the mountains and got super sore, and we were talking about how to prep for skiing. We did a couple of demos on exercises. If you have any questions on those exercises on how to prep, check back in our links and you can see 3 really good exercises. But this is the case where it's not soreness, now it is an actual injury. And we want to talk about 3 of those common injuries. So first injury is what?
Yeah, so the first injury that we see often is actually can be a combination of 2. So basically it is a wrist injury, but traumatic. So a lot of times we can see fractures or really nasty sprains of that wrist. And like I said, the double up is that when you reach and injure your wrist, you also can hurt your shoulder as well. So why are these? These are because you're out there skiing, maybe you had to dodge someone, maybe you just fell and you're catching yourself, you're stopping yourself with your arm, your wrist gets bent back and your shoulder gets bent back as you're locked out.
Yeah, lots of momentum, being stopped by joints that maybe can't do that, or there's just too much speed involved. So wrist, shoulder, last one, we're looking at knee. We had some really good cues last week on trying to keep really good lines and angles. This is exactly why, because if we don't have those good lines where ski goes this way, knee goes the opposite way, we can start getting ligaments that are a little bit angry. So MCL, ACL, PCL, LCL, any of those 4 ligaments can get torn. We can have some irritations across the knee. So when we start having like a training aspect that's trying to drive really good lines, that's exactly why, because we don't want any of that stuff to happen. So those are the 3 injuries, and this is when we need to actually go get them assessed. These are the scary things that you need to look out for. Be prepared.
Yeah, so hey, sore versus injury. So when it comes to the wrist, if you are seeing a lot of swelling, especially bruising, maybe your fingers are swelling, getting tingly, all of that would be to the degree of, hey, we should get this assessed, especially if you're not able to move it without substantial amount of pains. We need to get x-ray, imaging, or just get assessed and see, the extent of the damage. Now, when it comes to the shoulder, okay, and the different areas of the shoulder and the different tissues there, we want to get that assessed as well with, again, the same kind of swelling, any bruising. Sometimes when you compare to the other shoulder, you'll see some different changes. You might see kind of a bulge or a bump. Those things might say, yeah, we got to look at those bones, in addition to the inability to raise that arm. A ton of pain with raising that arm. If you can't even move it, to 90 degrees already, huge problem. You need to get it checked out.
Yep, so malformations, both wrist, shoulder, and then looking at the knee, we're looking at big swelling again. If you can't weight bear, if you feel like it's gonna give out on you, if you're very scared or hesitate, and also looking at big egg-sized swellings on either side, those are big red flags for us. That means that there's significant tissue damage, and you need to get assessed, and you need to get to the right provider. So if you need help with any of the assessment sides of things, we can probably get you figured out and where you need to go. If there is a big tissue damage, then that's when we might need to refer out and see if there's anything else that needs to happen. If you guys have questions, let us know. We'll be back next week with another edition of Doc Talks. We'll see you then.